Good afternoon, everybody. Okay, so we are joined by a very good friend of mine and a doctor, as well as having, how many degrees have you got? How many letters go after your name, Miggy? There's a test. You got BSc biology.
Didn't tell me I was going to get asked that.
Well, sorry, I'm just springing questions.
Yeah.
That's pretty much my style, though. So, do you want to just say a quick hello and to the peoples out there? Oh yeah, I'll set us into gallery view.
Hello. I'm getting that feedback you talked about.
Just mute. Okay, I'll take over. You just mute yourself on YouTube is the best thing you need to do there, and then you can, then you'll be good to go. So as soon as you can just wave at me, and then I can point you back. Have you found the YouTube window? Or you can just, in fact, if you want to, you can just close down your browser, and you can just speak to us in Zoom, and I'll send you the questions.
There we go.
Okay, you done?
That was quite stressful with that.
Oh yeah, tell me about it when you just get yourself on loop. Okay, so what's your name and where do you come from?
I'm Catherine, and I live in Devon, and I went to medical school in Brighton and Sussex medical school. Now that must be about 5-6 years ago I graduated.
What A levels did you do? I don't even know the answer to that.
Biology, chemistry, maths.
Hey.
Is that what you do, Rich?
No, biology, chemistry, geography. I avoided the maths.
I did biology, chemistry, geography, and history. So quite the selection. Well, mostly biology and chemistry. Ronnie, what A levels did you do? Ronnie's here.
Maths, philosophy, theology.
Oh, weirdo. Okay, so today's going to be a bit of a Q&A. I'm doing the same thing that you had because I hadn't opened my YouTube browser. Okay, Q&A with Dr. Miggy also did a biology degree with me. So if you want to ask differences between like a science degree, biology, and medicine, then there'd be good ones to throw in there. We've got a couple of questions that were asked on the Instagram story that we did earlier, plus some others that were asked on the Monday live check-in from last week. So shall we Ronnie, can you gather any good questions from the chat and then feed them back to me? Let's start with, Slack would be fine. I'll go some of the ones. So T-Boy, who I can see is in the chat right there, had asked a question on last week's live. Said, will they look at A-level grades when you take medicine as a postgraduate? For example, you have BSc biology. What are your thoughts on that?
They will. It's on your application, so it'll be plain to see, and may provide something for them to talk to you about if there's any surprises in your grades from A-level, perhaps. But I would have thought that they'd much more focus on your most recent achievements. But I couldn't really say for sure.
Yeah, I guess it will kind of depend on your application. As you say, like they're probably going to look at your degree, first of all. You've got a degree at that point. I mean, any employer is going to start with most recent or highest level qualification and sort of work their way down. Okay. Any follow-up questions from that, T-Boy? Then just let us know in the chat. I can see that you're there. What was next? The next one was from Fatima, also left from last week's live. How can you increase your chances of getting a place in postgraduate medicine? I know the experience is very important. However, should it be at the clinical level? Do you know any places that offer that?
Was that for getting into a postgraduate place?
Yeah, it was postgraduate.
Accelerated.
Yeah, postgraduate medicine.
So it's definitely much more competitive to get onto the postgraduate courses. Their competition ratios to get an interview are much lower, higher, whichever one which is harder. So being a postgraduate, getting into medicine might be in some ways easier because you are likely to have some more life experience or job experience that you can draw upon. Yeah, that's the main things I would say about that, really. To get into a postgraduate place, you do need a very good application. I applied to a postgraduate place at King's, having not really seen the competition ratios, and I think I probably wouldn't have if I had known. That's not to put anyone else off, because you may have a fantastic application to put in. But
can you remind me what the difference is between a postgrad? It's a shorter degree, right?
It's a shorter degree, yeah, 1 year less, and it's financially better as well, because you get, I think it might be something like free tuition fees. You might have to look that one up, but it's something like free tuition fees as well. So
that's a Brucey bonus. But you said, yeah. So that takes on to Fatima asked a double-headed question. So the next question is, how competitive is it for postgraduate level? And there was a response to that. You give me your answer to that first, and I'll follow up.
I would say it's probably at least 3 or 4 or 5 times more competitive, and it's quite competitive just to get onto undergraduate courses at the application level. Because I think the hardest bit is getting an interview in the first place. It's having the best application that you can put forward, like the best personal statement and CV, to get an interview in the first place.
And the first part of Fatima's question was about clinical level. I don't know exactly what that means. Clinical level work experience, how to go about that. What work experience did you do in order to get your postgraduate place?
The relevant work experience I had was, I had a job. Well, my best work experience was I had a job as a healthcare assistant for, it was probably 6 months or more after graduating from biology. And that demonstrates a lot of things that you can't necessarily demonstrate when you are work shadowing, perhaps, because it's actual work that you're having to do. It's hard work, and it also shows your willingness to do what's necessary to get the good work experience.
Lots of the dirty jobs, from what I remember.
Definitely lots of dirty jobs.
Yeah, that's it. I think from what the students that I've spoken to that have gone to med school and stuff, and it's just having patient contact, I think, rather than just stood behind somebody taking notes and watching what they're doing. It's actually getting stuck in, isn't it? And dealing with people face to face.
Okay,
and
so
dealing with those long shifts as well, because healthcare assistant jobs, they're 12-hour mostly shifts and night shifts and that sort of thing. So it shows what you're willing to go through to get your experience. The other experience I did have, it was through connections, and that's a challenging thing if you don't have any connections, but there are ways around things if you can find someone friendly to help you. So for example, I spent 2 weeks at Chelsea and Westminster Hospital just shadowing in different departments, which was a really good work experience, like work shadowing. I wasn't doing any job like stuff. I was kind of able to join in on the ward rounds and follow around junior doctors. But that was because my dad knew someone in the admin department in the medical school, which was just lucky. But you can sometimes find through friends of friends, perhaps sometimes, if you're lucky.
So the other way, the story there is don't be shy, reach out, ask for friends of friends kind of connections. It might not be your immediate sphere, and it might be someone in the admin department that you might not immediately think is that well connected, but they know someone that. So I think be bold, I think, would be my general advice with work experience in general, but I think especially in medicine, ask, and don't be afraid to ask the question. Okay, so we've got questions lined up. Ronnie's sending them through to me, so we will get to all of these. One from Shannon coming up. We've got Zohib, Edith, Benny, Sarah, and Lauren. Okay, so just so that you know, we are going to address all those questions. I think I'll just go through them in order. It's going to be the easiest for me, and we will answer them, and we'll have time for them. So from Shannon, did you find it more beneficial doing medicine as a second degree, and sort of like, why did you choose postgrad instead of just going straight in? A kind of a double-headed question there.
Well, so when I I always had thought about medicine, but it's quite difficult if you haven't had any experience to know, because it's different to other degrees because it's so vocational. You're not doing it to do something else. You're definitely doing it to do a career. And it's quite difficult to make that decision to become a doctor because you don't necessarily know what it's like unless you've got a family member who is a doctor and they can really tell you. So coming out of school, I couldn't say for sure that I wanted to be a doctor. So I did actually apply the first time round, but didn't end up going through with it. And
so you applied for biology and medicine on your application?
Half and half. And did get an interview, but didn't actually end up going, declined it in the end because I couldn't take that at that point. So I think after doing biology and having some work experience, for me, it was better to go in postgraduate because I was so much more sure. Because there is a little bit of dropout, and it did seem to be mostly in undergraduates rather than postgraduates, because if you've gotten to the postgraduate stage, you've probably thought about it a lot. I mean, everyone has thought about it a lot, but you might have thought about it even further because you've tried some other career decisions out in your head or tried them even.
Yeah, it's
and
a big
decided
commitment.
that you wanted to be a doctor after all of that.
Okay. Shannon, let us know if there's anything else on that. Like, was there any benefit, do you think, doing it as postgrad versus second degree? I know Shannon's doing biomed right now, and so she's thinking about doing medicine after that. So any benefits of doing it as a postgrad, or pros and cons maybe of doing postgrad versus undergrad?
Doing it after another relevant degree, you might actually cover some of the like stats and some content might actually be slightly easier for you, but not necessarily. I would just say it's more personally it can be easier to go into at a later stage.
Quick question.
I'm biased, of course, because like I didn't go into it as an undergraduate, and actually if you had an undergraduate who went straight into it from college might tell you something slightly different. So
do GCSEs have a big impact on med school applications?
I think probably similarly to A-levels, that if there's anything like, say there's a particular subject that is semi-important that you did really badly in, it might be something that's talked about, but I wouldn't have thought that anything, as long as you've got the bare minimum of, you know, what most jobs need, then and there isn't anything too surprising there, then I wouldn't have thought it would be that important.
Yeah, if you got a D in French GCSE, or now it's not even a D, it's you know, if it's a 3 or whatever, then they're probably not too worried. But if you got a 3 in maths or biology or chemistry, then it might raise a bit of concern. I think I agree with that.
Speaking about, I thought we just share the questions out. Ronnie's posted them in our comment thread, mate. So as a link to that, do you find, did you have students with you who are postgrad that have come from other degrees? So you obviously came from biology yourself, Catherine, but were there maybe some chemists in there or natural scientists, science students or anything like that?
Yeah, there were lots. In Brighton, there was a very high proportion of postgraduate students. So a third were graduates, and they ranged a lot in age. So from 23 straight out of another degree, perhaps, or 21, even 22, to right up to early 40s. So there was ex-paramedics and nurses and some quite often in fairly relevant other jobs that have switched. But lots of people had done things like biomedical degrees and other relevant degrees.
That's good.
Yeah. Did you have to pay to study medicine at postgrad? Was a question from Edith.
Yeah, I kind of half covered that earlier, really. If you went on a specific graduate course, the accelerated course, which there aren't that many of them, but they're the really competitive ones, then it is a lot cheaper because you don't have to pay some of the tuition fees, and you might even get some sort of grant, I forget now. But I was on an undergraduate course. It's just as if I could have gone straight from A-levels.
Okay.
So it's the normal tuition fees, etc.
Yeah, we got a lot of students who are looking to apply. So they're just finishing their year 12 now, or supposed to be just finishing their year 12 now. I mean, would you, and we got some in year 13 that have applied and obviously just waiting on these calculated grades. So for the year 13s, Catherine, obviously they're quite limited in what they can do in preparation, like in terms of volunteering and getting out there and getting stuck in, as we were saying before. Is there anything you might suggest they could do possibly in preparation for starting, hopefully, in September?
Well, so these are students that have got provisional offers, is that?
Yes, so our year 13 students, they've got their offers and they're just waiting for their grades to come through now. So,
okay. So as long as they get their grades, they should get on the courses.
Yeah, that's it. But I think they're just thinking, you know, what could they be doing something constructive now, maybe, or reading up on something, or
there probably are things corona related, but I would have thought that would be mostly covered in induction, actually, probably the most relevant stuff for your hospital. So there'll be lots of things that they could potentially look at, and there might even be webinars and things on Royal College websites, but I don't know if they actually have access, so I'm not totally sure about that, really.
My suggestion was I guess it's mostly Latin, some Greek, the anterior, posterior, lots of the prefixes and suffixes, which are just like part of the language. Just to be familiar with the top 100 of those. I'm sure there's a web page somewhere for people training in, it's not necessarily medicine, but nursing and all those kinds of things.
That's not a bad thing. But I would also say you're about to do lots of work. And this, although there's not to be fair, if you don't have anything to do this summer, which you might not, then there's no harm in doing a bit of extra reading. But also all of that stuff will get taught to you, and you'll get the practical experience using the terms, which is, you can't really substitute. It's quite difficult to remember all that stuff unless you're not using it.
Any tips for starting a medicine degree, or in the things you wish you'd done differently?
It's about a continuous level of work. You can't. My previous degree, I think the first year, I didn't need to do all that much to get through it. But medicine's a bit different. There are a lot more tests all the way through, and you definitely don't want to be cramming. So I would say it's hard work, but the hardest thing is getting on the course. Once you're there, you can just put the hard work in, and you will get through it if you've got the motivation to do it. And so it's just keeping it up, and also making sure you do lots of things out of medicine, because a lot of people get their heads down and get a bit swamped by it all. But making sure you don't give up some of your other activities that help you cope, like your exercise and your.
Well, something I was commenting on with I don't even remember who I was having the conversation with. In the UK, basically all doctors have got biology, chemistry, and then maybe maths or maybe one other A level, but you have to specialize from 16 after your GCSEs. And like, it's a very narrow educational skill set that most doctors will have, because you've got basically very little choice. All of that has to be done. If you want to do music, if you want to do drama, if you want to do sport, pretty much all of that has to be in your spare time and on you. So I think that's great advice to don't give up on all your things that you do for fun and all your extracurricular activities, but you will need to make time for that outside of study.
Mm-hmm.
Any others there, Rich?
There's a few people asking about the UKCAT and what's the other one as well? GAMSAT, is it? And things like that. So they're asking if you had to do that for postgrad, or if you ever had to do them at all. And if you have, what advice would you give to anybody that's looking at doing that?
I did both. Different medical schools want different things. Most of them wanted UKCAT from when I was applying. A few wanted GAMSAT, which is much more involved and I think more expensive to do as well. And there's preparation you can do. I don't know. I think I must have done it online, or I can't remember what sort of preparation I did for that. But UKCAT was much more just an aptitude test. So it was more like almost like an IQ test. Which you couldn't necessarily prepare for that well from my memory. But GAMSAT was a lot more like, it was a bit more it was almost essay based, so it was a lot harder as a test. I did both mostly because I was indecisive about where I was going to apply, and I think the postgraduate courses might have wanted the GAMSAT.
Do you remember was it an arduous task preparing for that, or was it frightening, or did you was it a bit time investment?
The arduous bit is the length of the exam for GAMSAT. UKCAT's fine, really. It's just you have to be quick. It's not an exam you can hang about. You don't have time, so you run through it quite rapidly. But GAMSAT, it was a really long test. It was ridiculous, like 3 hours or something of sitting down doing it. So that was the hard bit about it, is keeping your attention during that. I can't remember what preparation I did really though.
Maybe it's a couple of quick fire. You may not know some of these, so you're welcome to pass. Sarah asked a long time ago, degrees in medical sciences and versus medicine. I don't know exactly what medical sciences are. Which would be better to get into lab work? I'm assuming like hospital lab type work.
Medical sciences, I think, is for lab, more like lab, like biomedicine, that kind of stuff, and chemistry is going to get you more towards lab.
Did you take any gap years in that cycle?
Yep. Yeah, mostly just for fun, mostly not for furthering career stuff, although I did a little bit. So, but that was once I'd already started medicine, actually. I had a couple of gap years before medicine, and that was where I managed to get all of my good work experience with healthcare assistant work and that kind of thing. But once I'd started medicine, after I'd graduated, I went straight into foundation years for 2 years. And then after that, I had a year off. And during that year off, I went on a couple of just fun trips, along with getting a job as a cystic fibrosis fellow in the BRI in Bristol for 3 months. But yeah,
nice.
It's all good stuff, because otherwise you're on a bit of a long treadmill.
Yeah,
because obviously I'm still training, although I have had a fair bit of time out.
Richard,
there's a couple of people asking about like specialisms. Obviously, am I correct in thinking you're like training, like in your GP training right now, Catherine? So at what point did you always have that in mind? At what point did you kind of decide that that's the area you wanted to go into? And there's a couple of students saying, asking about specializing in surgery or various other areas. I mean, do you get the opportunity to explore those during the medicine?
Yeah, definitely. Lots of opportunity. There is quite a lot of medical schools are gearing a little bit like trying to encourage people to go into general practice, because there's a major shortage. So you do get a lot of that experience, which I really like. But your medical school won't particularly steer you. You've got like any choice, and you get exactly the same experience as everyone else. So you can go into anything: medicine, surgery, GP.
Is it the same amount of time to specialize? So you do your degree, and then it's the foundation year 1, foundation year 2.
Yeah. And then you're doing your specialty training. So if you become a GP, it's 3 years full time after that to become a GP. And then but if you go into medicine, which is like respiratory medicine, cardiovascular, so all sorts of different things, then you do your core medical training for 2 years. And then I think it's 4 years after that. Which is specialty training as a registrar. Whereas, and everything's slightly different. Like there might be a year more, a year less for different specialties, but surgeons might be something similar. Sometimes it's longer, sometimes.
Did you have many interviews for medicine? Like, did most places interview, or did most places just look at your application and say yes or no?
I applied to Southampton, and they don't interview, or they didn't interview when I was applying, but I got a no from them. But then I was interviewed by everyone else. So that was St George's and BSMS, and then the other one was a no, Bristol. There was two yeses and two no's.
Any killer questions or any interview like things that really stick out in your memory?
Oh yeah, I remember one particular question which went terribly. What did they ask? It was, so this is going to sound ridiculous. What's the difference between a nurse and a doctor? And I couldn't at the time. I think I'd made up something which definitely wasn't true.
We've all been there.
How would a GP answer that question now?
I know now.
Go on, then give us a textbook.
And I thought I knew then, but bizarrely, describing it is quite difficult. What do they actually do differently? Because actually, quite a lot of nurses manage doctors. They manage the wards. It's their wards, and doctors kind of come in and come out, and that took a bit of thinking.
I live with a nurse in Canada, so I get to hear the nurses' side of things very often.
Yeah.
I've got a general question. I think this is probably ignoring the fact that COVID's around at the moment. Someone on Instagram was asking, what do you think the biggest challenge facing GPs and junior doctors is at the moment? COVID aside.
Okay, yeah, we forget about all of that if we can.
Yeah.
I'd say it's kind of all the classic things. It's the aging population, the multiple comorbidities, and the fact that GPs, certain communities are served better by GP than others. So more deprived areas have less GPs, but actually really they need more. So that's for general practice, that's a big challenge, is the workload. And the less nice side is the sort of slightly defensive medicine, perhaps, like because you have very educated patients who know what they want, and it can be quite difficult to manage that if you have a different idea of how to manage things.
Yeah, especially I think if they've been visiting Dr. Google and they maybe come to you like, I've already read this up and this is what I need, and it's like, I bet that's really difficult.
Yeah. And also mental health, I'd say, because there's very little services, and that's probably going to get worse now. And children's mental health especially is very poorly served.
Yeah, it's certainly at the forefront nowadays, isn't it? It's there's a huge light being shone on mental health right now, and rightly so. But like you say, I mean, current climate, considering where we're all at right now, like you say, it's not going to help the situation, I'm sure.
If you were, I don't even know who health minister is, if you were the Lord of the NHS right now, or the Lady of the NHS, any sort of...
I wouldn't like that job.
No. Any suggestions, any tips or advice, any sort of broad sweeping changes that you would make? I mean, it's obviously complex.
What, coronavirus excluded?
Yeah, general NHS.
Oh, you put me on the spot now, Rich.
God, well, you maybe really save that one up as a kicker.
Save that up for another time. That's probably quite a good interview question, potentially, though. It's something to think about. Like, if there's... Yeah, it's good to have good ideas, even if they tested and not that.
Okay, so there was some questions about GP training pathway. Do you spend time in hospitals, or are you mostly based in surgery when you're training as GP?
GP training is half and half hospital and GP. So you usually spend about the first year and a half in hospital. You do 4-month or 6-month jobs depending on the hospital. So you get quite a wide range of experience. Well, you get lots of experience in foundation years in all sorts of things, and 4-month jobs. So you rotate around different specialties, surgery, medicine. And then in GP training, you do the same, but you don't do surgery anymore. So you do mostly relevant stuff to GP, like pediatrics, obstetrics and gynecology, and psychiatry, and ENT, and ophthalmology, and A&E.
Anything to be aware of sort of that you have insights of now you've done a medicine degree? Anything you kind of wish you'd known before you committed to doing medicine? Like, just in case you making the sort of, you know what that decision is like. You hummed and hawed about doing medicine as an undergrad, and then post biology you did the same. Anything you kind of wish you'd been told?
I'm not sure.
Would you have,
sorry, I don't have anything.
In hindsight, would you have gone back and just said, just do it from undergrad, or would you quite?
No, not for me. I had a great time in biology. I wouldn't take that back for anything.
Right.
But you, Rich.
Yeah, you've never met me. I was going to find some old photos of us, but I ran out of time this afternoon. I was going to share some photos of my crazy afro and my dreadlocks and whatnot.
But, some fun times in Tobago.
What about aspects of the degree then? Which did you enjoy the least, or maybe find most difficult?
Yeah.
We do modules in statistics and that kind of thing. So less, because you have to do certain things. There is a bit of choice in modules and during medicine, so you can do some special interest modules.
You can avoid the ones you don't like the look of then.
Yeah, slightly, but you can't with some of the core things. So there's some tough bits that you don't get a choice about. But there's lots of help, there's lots of support. Medical schools are really well resourced for lots of support.
There was a question that was sent through, is mental health a problem in med school? And is there any
definitely. I'm not speaking from my personal experience, of course. So there's a lot of anxiety, as you can probably, the population of medical students is quite a high performing, anxious lot. So there is definite, and they're examined a lot. So there's the potential for people to get quite overwhelmed. And there's a lot of exam comparing and that sort of thing, which is not very helpful. Leading up to exams, I'm sure everyone's experienced that. What did you get? What did you?
I don't know if I asked you. There was a question there. Was that, is there much competition once you're in medical school? And I guess that answers it a little bit.
Although yes, because you only need to pass in medical school. You don't need. I think you can get like distinction in your grades, but it's not necessary actually for where you're going. So in a way, there's not competition between students in medical school, not that I experienced anyway, because everyone just wants everyone to get through it. And so once you're in, that's the hardest bit, getting in. And once you're in, you just need to do the hard work, but you don't need to be the best in the class, although some people will think they do.
Question from Edith about how you handle traveling to placements. Did you have to have your own car? Was accommodation provided?
Accommodation is mostly provided if you're being sent to a hospital, which is quite a fair distance away. It doesn't even have to be that far. Like from Brighton, we went to Chichester and Red Hill and Haywards Heath, and there would be accommodation provided in those places if you wanted it, but you could travel if you wanted to. We mostly live shared. I didn't have a car at uni, so you didn't need a car. You could definitely get by without. And but afterwards, when you do GP training, you need to be able to drive, because that's part of the application to GP training actually, because you need to be able to do home visits. But up until then, you don't need a car. You don't need to drive.
Fab.
Yeah, you end up being the one that drives people around at university. You don't want to be that person.
Yeah, good point. It might actually be a benefit not to have a car.
They'll love you, but they probably won't. They'll pay you a bit of fuel money, but that's probably about it.
There's a couple of students in here asking about the F1 and F2 years. They just said there's no question really attached to it. They just want to know about it.
What's it like?
And any insights you might have, Catherine?
F1 is a big transition year because although medicine is a very vocational course and you spend a lot of time in hospital, you are in quite a shadowing role in hospital, and then suddenly you've got responsibility, and F1 is hard. It hits quite a lot of people quite hard, but people get through it. It's not the most enjoyable year because you're doing so much adjusting and work is very busy. It seems, especially in F1, which is a bit harsh, isn't it? But because you're the first point of call for all the nurses, so when you're on call, it can feel like a big load to carry. Because you don't necessarily, there's a lot of personal pressure that you put on yourself where you think, you get a call from a nurse and you think, I should know what to do in that situation, rather than necessarily getting help as often as you probably should when you're an inexperienced doctor. And you carry about a list as long as your arm that you need to get round to doing. And it's very busy. But the nurses will give you tea and a hug if you need it.
Oh,
but not now. Unless you
no, not now. Good point, actually.
No, I think that's amazing.
So now that you've graduated, would you say that medicine is similar to what you expected, or is there anything that is not the same as you had expected?
I think it's better than what I expected it could have been, actually, because it is a fantastic career. It's you're surrounded by very motivated people who want to do really good things, and that's a nice atmosphere to be in. And working in the NHS, although it's understaffed, there's a lot of camaraderie, and it's enjoyable on the days when you've got enough time to do everything. And also you never stop learning. You can't stop learning, and that's really refreshing. I know that's kind of the case with everything, but you get taught a lot throughout your training. I get taught a lot on all the ward rounds. You get time spent teaching you new things from the consultants, and you meet a lot of very nice people, patients as well. Not all, but almost.
Did you consider any other careers after biology degree?
Yeah, I did a bit of work experience in ecology, doing some environmental work, but then I realised there wasn't very many jobs. And I kept coming back to medicine. Also, I did think for a little while I wanted to be a teacher. And those sorts of thoughts that you do have are things you can talk about in medicine, because it's fine to have had other career ideas. You don't need to live and die medicine, and it's probably better if you don't, actually. Like teaching, for example, you need to want to be taught for a long time and want to teach people, and to be able to demonstrate that in an application to medicine is very beneficial, because you need to be able to do both of those things. Yeah, so having wanted to be a teacher for a little while, that I remember that being something I could talk about in an interview, and I think that was probably a good thing.
Yeah, because communication is really important in both of those aspects. I mean, you're still just dealing with people, right? It's just in a different context.
Yeah.
Kind of linked to the whole kind of that we were talking about before about what students can do before they go to university. There's some students asking about if there are any recommended reads out there. So if they were thinking of maybe trying to kind of get their head stuck in a book in preparation for either this September or next September, anything on your kind of hit list in terms of reading you'd recommend maybe? Put you on the spot again, Catherine.
No, I was thinking, I think I can think of a couple of things. I don't know if you can get access to it without having a membership, but if you want, like, you know, current articles, that's always good material for interviews, and to know what's been in the news and that kind of thing for medicine. Then the student BMJ is a good magazine to have, to be able to like flick through. But you can probably, I would have thought you'd be able to access at least a little bit of it online anyway, without.
BMJ is British Medical Journal.
Yeah.
There's one that mentioned a student mentioned do no harm. I don't know it, but
that's one of the Hippocrates oath. That the Hippocratic oath is the first thing is do no harm.
Okay.
There's lots of things, and at the end you actually go through that at your graduation, which is quite cool.
Oh, nice.
I'll read it out.
Hippocratic oaths. There was a suggestion in the chat that I'm just trying to see now, but I can't. I don't see it.
I think there's a book called Do No Harm. I think.
Or maybe. And there was.
Oh, is that what they were referring to?
I think so.
Yeah, I didn't. I suppose it's quite good reads to read anyway. You know, like there's quite often like those like junior doctor books about life as a junior doctor, like the funny stories and the difficult stories. That's good stuff to read, because that gives you like personal, difficult, ethical scenarios. Because ethical, that's another thing actually for the interviews. They're always ethical questions.
Yeah. Okay. Yeah. A good bit of advice there. I don't know if you read. Is it Bad Science was the first one? Bad Farmer, I think, was the second one. Ben Goldstein. I don't know exactly who, but Bad Science is about misuse of science in medicine, lots of bit of homeopathy, and it then looks into the placebo effect in more detail. So I take general books around that. But if you have a solid foundation, if someone asks you a question in an interview and you can say, well, I'm not sure exactly about that, but it's similar, it reminds me of this book that I read, and you've got some substance with it, you might not know exactly the thing that they're looking at, but I'd say that having a good solid foundation in those kinds of things would be a good advice.
Yeah, one that is kind of a lighter read. There's a new Bill Bryson one out, The Human Body.
Yes.
A guide for occupants or something like that.
Yeah, I think that would be a great read, both for fun and in terms of basic broad spectrum human body anatomy. He's very well researched. He's not a scientist, but he does lots of research with lots of scientists and gets it well checked. I know A Short History of Nearly Everything, which was his first sort of science book, is accurate. It's not nonsense by any means. Right, let's take a couple more. We've been chatting for 45 minutes now. So, any more good ones in there? Ronnie, any outstanding ones that we haven't really covered? I think we've done a good job of selecting
the most common ones.
Yeah, I mean, there was quite a lot a while ago about what actually happens when you start the course. I'm not sure if we answered all of them. So can you choose what rotations you do? What's harder, the volume of work or the difficulty of the work? Can you choose your hospital for your foundation year? Okay,
can we just park that? So do you get any of those, Mingy? So can you choose your hospital for your foundation year? What's harder, the volume or the difficulty of the work? And what's it like starting off the degree? Was that?
Yeah.
Basically, what's it like at the beginning? What's their first couple of months going to be like?
As a doctor or in medical school?
I think med school. I think more uni is probably most relevant to those in the chat here.
I think it's the volume of work in medical school, really, rather than the difficulty, because I'm sure some of it was difficult. I just can't really remember exactly. It was more just if you did the reading and you understood the stuff behind it all, then it wasn't hard stuff. It's the volume. And then it's also the connecting everything together. eventually when you get into the more clinical years, where you're seeing a patient and you've learnt about the science of something, but actually how do you get from the symptoms and then examine them and find the clues that it's that disease, and what you do about it, and then the art of like managing it with the patient, because you can't manage everyone the same. So that's a bit further on, isn't it, really, rather than medical school? But so it's just the volume, I would say.
Yeah, I mean, A-levels are very tricky. So I'd say the level of difficulty doesn't jump up massively, but you are expected to do the work without being prompted. Basically, you go to your, is it still lecture based? What does the average week of the first term of med school looks like? Lectures, labs, practicals?
Yeah, it's really varied. So my course at Brighton, which was based on Southampton's course, because Brighton's a new medical school, or fairly new now, it was lecture based, but there were, I don't know if this is still the case, but there were lots of medical schools that also did problem based learning, which I didn't like the sound of quite so much for me. I think I would want someone to tell me what the lecture content was, and then I could go back and do more reading about it, rather than the problem-based learning was more you learned it as a group. So it was good for maybe good individual learners who work well in a little team where you trust the other people will do the work, and then you're like bringing the knowledge together. But I quite liked a lecturer telling you what you needed to know. And then you
an interesting one for me.
And also there was lab stuff. There was like you did cadaver dissection quite early on. I think it was in the first couple of weeks. And also you did, in Brighton, you had early clinical experience, so which I really liked. You were in general practice within the first couple of weeks. In the first year, I think you mostly did general practice, just half a day every week to get some exposure, and then it jumped up in your experience in third year. So third, fourth, fifth, you were mostly in hospital, and you would have lectures, but you were mostly based in hospital rather than in more the lecture theatres.
An interesting one. Would you advise someone doing medicine if they're uncomfortable with handling blood? Is that something you get used to?
So I don't like having my own blood taken. So I suppose you will have to get used to handling blood. There's no getting around that. But I would have thought you could get used to it, as long as it's not an actual phobia, probably. But I mean, even phobias you can get over. So,
well, a friend of mine was doing nursing, and I remember she phoned me late at night one time, and she said she'd just started, and she was feeling that was the thing that she was feeling really uncomfortable with, and it was a big obstacle to her, and now she's totally fine. She got over it. It's just like, it's part of the job, and it's not, she doesn't love it, but it doesn't freak her out anymore. It doesn't make her squeamish. So I think, unless it's like really extreme, I think I never used to have an issue with it. My dad, always watching Casualty growing up, my dad would always like turn away or read the paper or something. And like, I never understood that, because I was totally fine with it when I was younger. But as I've got older, I definitely get a bit like, I just a bit uncomfortable. But I think with exposure, you get used to it.
Yeah.
Well, I think there's so many...
You do watch operations as well. So I mean, like, there's exposure, and there's exposure. But I actually think worse than blood for me is sputum. You probably everyone has their worst bodily excretion. Sorry, the baby's coming upstairs. There might be a little bit of noise.
I was just going to say,
that's not the only bodily fluid you kind of got to deal with, really, is it?
No, there are maybe worse things.
The whole range is coming at you if you don't. Well, let's knock it on the head there. There's still a whole bunch of questions. I suggest if you've got outstanding questions, put them in the comments, not in the chat. I think there's so many of you. We'll revisit this. Maybe we'll get a med student to join with either Miggy, if she's prepared to go through the torment of your questions again, if we'll come back to this at some point, maybe.
Yeah, I didn't mind.
Yeah, well, on that note, I can confirm today that on the 25th, so that's a fortnight today, so 2 weeks today, we'll have a panel of second year medical students who are going to be here to answer your questions. So they're living and breathing their degrees right now, undergraduate degrees right now. So if you got any more questions about what they're doing in uni and stuff, then you can put it to those in a couple of weeks' time. Okay,
so next week is basically a career biologist. He did a biology degree with me again. He's one of my uni mates who is now working as a fellow at, I read all his blurb and I now can't remember it, but basically he's done London a biology degree and then he's gone. What does Jimbo do, Miggy?
London Zoo.
He works at London Zoo, and he's basically
megafauna
world experts on the elephant bird. So the elephant bird is the biggest bird that has ever lived. It's now extinct. It lived in Madagascar, went extinct about 7,000 to 10,000 years ago. But he's followed basically in academia. So post doing a degree, he's done a PhD, and he stayed working in universities, and he will tell you all about doing that. So I will share. Also, we're going to have a competition for next week.
It's released.
Oh, so it's on the Instagram
competition
page.
got released?
So check out the Instagram. It's a captions competition. Best caption that we can read out on YouTube to be read by judged by James himself next week. So this is the image. If I can, yeah. So this is the image for the caption competition, the only accepting entries on the Instagram page. This is an elephant bird. I think it's a thigh bone, but we can ask James next week. So answers on a postcard, well, actually answers on the Instagram page. It's published right now. So head over to the Instagram channel and enter to your heart's content. And yeah, we'll let you know about when we'll be back online with another doctor or with Miggy, and basically chuck all your questions on this one and we'll gather them all together, and then we'll be here to answer them all, make sure you've got all your medicine inquiries dealt with. So next week, same time, same place, for a bit more biology degree and what it's like, some options going into some sort of post degree level academia, basically. Thanks everyone for your questions. I'm sorry if we didn't get around to them. We done the best we can to gather them all together and put them all together for answering. We will see you same time, same place. So Monday, 5 o'clock. Thanks so much to Miggy or Catherine. It's totally weird for me to call you Catherine. Miggy's always been Miggy to me. And I think that's about it for me. Any final words, Migs? What would your parting words to a budding medicine student be?
I suppose practice your interview technique. I suppose that's you can't, you've got to do a lot of practice because you'll end up messing up your question answers.
Know the difference between a doctor and a nurse?
Yeah, that might be one.
Okay, great. Yeah, we'll see you same time next week. And in the meantime, I need to find the right window so I can stop staring things.
Yeah. Thank you very much.
Yeah, thanks, Migs.
Bye. Bye-bye.
We're offline.